No, thanks for making it to Veterans Info Tap. I'm glad you made it. Just wanted to give out one more reminder, and I'm probably going to do a couple more actually by the end of the month, that the deadline is fast approaching. The deadline is September 30th, 2023. September 30th, 2023. We are in September of 2023 currently. And this deadline is going to be fast approaching. This is the next PACT Act deadline for healthcare enrollment for veterans deployed to combat zones. There is a special enrollment provision that is provided for veterans who have served in combat zones. Now, for those that don't know, in order to get VA health care, you have to have a qualifier to get into it. Now, some of those qualifiers are maybe income based, right? So you don't have income, so you're low or no income. It's mean tested, right? So they're going to check your income. They're going to go, you don't make a lot of money, and so we're going to go ahead and allow you to come into this VA healthcare. Or maybe you're a Vietnam veteran and you get access that way, or you're a former prisoner of war, or most commonly is you have a service-connected disability or disabilities. And then that opens up the doorway to VHA, Veterans Healthcare Administration, for healthcare. And most commonly, it's because you have service-connected conditions is why you now qualify. The form that you would use to access VA healthcare is the VA Form 10-10. That's 10-10. Now, I'm going to read this little short announcement here from the VA regarding this deadline for you. So until 11:59 p.m. on September 30th, veterans who've deployed to a combat zone who have never been enrolled in VA healthcare and left the military between September 11th, 2001 and October 1st, 2013 are eligible to enroll directly in VA healthcare through the PACT Act. This special enrollment period gives veterans who served in Iraq, Afghanistan, and other combat zones an opportunity to enroll directly in VA healthcare without first applying for disability compensation benefits, which again, getting your disability compensation, a service-connected condition, opens the door for the healthcare. So VA encourages all of these veterans to visit VA.gov/PACT or call 800-MY-VA-411 to learn more and sign up for VA healthcare before the deadline. Veterans who are enrolled in VA healthcare are proven to have better health outcomes than non-enrolled veterans, and VA hospitals have dramatically outperformed non-VA hospitals in overall quality ratings and patient satisfaction ratings. Additionally, VA healthcare is often more affordable than non-VA healthcare for veterans. The special enrollment period is part of the PACT Act, the largest expansion of VA healthcare and benefits in generations. Since the President signed the PACT Act into law August 10, 2022, more than 344,000 veterans have enrolled in VA healthcare, and more than 4.2 million enrolled veterans have been screened for toxic exposures. Are you a veteran who deployed to a combat zone but never enrolled in VA healthcare? You should sign up now. Even if you don't need this care now, you may need it in the future, and once you're in, you have access for life. But don't wait. The deadline is September 30th. So go to va.gov/PACT and apply today, said the VA secretary. Although this deadline is written into law for this specific group of veterans, many other groups of veterans are able to enroll directly in VA healthcare without first applying for other VA benefits, including many Vietnam veterans, Gulf War veterans, veterans who deployed to a combat zone and transitioned out of service less than 10 years ago, and more. And all of that is listed on the Form 1010. So you can read all the different qualifiers. Veterans who do not meet any of the above criteria can often still access VA healthcare by filing for VA disability compensation benefits or based on income. If a veteran is granted service connection for any health condition, they become eligible for VA care. The PACT Act also extended VA disability compensation benefits for millions of veterans making more than health conditions presumptive. I don't know if it's 300. I think it's 30. It's probably 30. Because 300 sounds like a lot. I think it's a typo. For service connection, this means that if an eligible veteran has one of these health conditions and served in the applicable place during an applicable time, VA automatically assumes that the condition was caused by the veteran's service and provides compensation and care accordingly. Since the PACT Act was signed into law, VA has delivered more than $1.85 billion in PACT Act benefits to veterans and their survivors. VA encourages veterans and their survivors to apply for these benefits now at VA.gov/PACT. VA is currently in full court press to ensure that as many veterans as possible enroll between September 30th to date, or before September 30th. To date, VA's PACT Act outreach campaign has included more than 2,000 events nationwide, $13 million in paid media, $60,000 earned media clips, 60,000 earned media clips, more than 400 million emails and letters sent to veterans, the creation of a one-stop shop PACT Act website, and more. This is the largest outreach campaign in VA history, which has one goal in mind: ensure all veterans and their survivors get the health care and other benefits they deserve under the PACT Act. More information on eligibility and for the special enrollment period that can be found at the VA.gov/PACT website. The period applies to veterans who deployed to a combat zone, never enrolled in VA healthcare, and left the military between September 11th, 2001 and October 1st, 2013. Specifically, those who served in theater of combat during operations during a period of war after the Persian Gulf War, or in combat against a hostile force during a period of hostilities after November 11th, 1998. For more information about the PACT Act and how it's helping veterans and their survivors, visit the PACT Act dashboard. To apply for care or other benefits today, visit va.gov/PACT or call 1-800-MY-VA-411. I will put all of this in the description below. The bottom line is that if you are a veteran who qualifies for VA health care and you've never been enrolled before and you're not service connected for any conditions, it might be a good avenue for you to go get enrolled in the VA healthcare system so you can go to the doctor and start documenting any of your conditions that you may have that you want to file claims for, right, for disability compensation. I know quite a few people who they really can't afford to go to a doctor over and over and over again and pay out whatever out-of-pocket expenses to go get, this diagnosis, get seen for that, try to do this, try to do that. So getting enrolled in the VA healthcare system would help alleviate some of that. Now, I get it. Sometimes the VA doctors aren't the easiest to work with when you're trying to file a claim. But if you don't need to get a nexus letter, and you don't need them to fill out a DBQ, then you're probably going to be good to go. And it's better than nothing, right? To at least get there and get seen. My suggestion, if you've hung on this long, is if you are seeing a VA doctor for a claim that you're planning to file, what you should do is, you can ask them if they'll fill out a DBQ or if they'll do a nexus letter if you need one, right? So those pieces. If they do, great, and if they don't, which is a lot of times the case, then what you need to do is you need to read everything in the schedule of ratings for your condition. Once you read that stuff, then what you want to do is you want to take it with you and tell the doctor the things that are in that schedule of rating for the specified percentage that you would qualify for, and tell them that you need to make sure that that is added into the notes verbatim. Now, another way that you could potentially do it is you could just type it out on a piece of paper, give it to them. They might be able to scan it and upload it into your file. For example, just as the top header, patient's signs and symptoms, onset. All right, patient's onset, signs and symptoms. Patient has whatever condition. Onset was whatever time frame, whatever the date is, right? So October 32nd, October 22nd of 1990, and that's in the middle of your time in service, and that was the onset. That's when you first started having that problem, and here's your signs and symptoms of that. And just ask them to put that in your file. You never know. I mean, the answer is always no if you don't ask. So you just want to make sure that you get the right information in your file and no shortcuts, right? You don't want a doctor to leave out 4 of the most important words that you need in there. You need to make sure all the words are in there when it comes to the VA making a decision on your claim. So with that, thanks so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.